All right, first thing I will do is review the physician's orders. Today we're going to do a sterile dressing change. Then I will enter my patient's room. I will provide patient privacy. I will perform hand hygiene, introduce myself. My name is Nick. I will be your nurse today. I will identify my patient by looking at their wristband. I will get them to tell me their name and their date of birth. Then I will explain what I'm doing. I'm going to be doing a sterile dressing change. I will ask the patient not to stick their hand or touch my sterile field so it doesn't contaminate it. The patient understands. After that, I will ask my patient if they have any pain on a scale of 0 to 10. If the patient does have pain, then I would give the patient pain medication and come back at a later time and then do the sterile dressing change if they feel better. After this, I will collect my supplies. I will inspect my supplies to make sure that they are not damaged, make sure the expiration date's right. I will place my biohazard bag at the foot of the bed so I can discard my supplies easily. I will then perform hand hygiene and set up a sterile field. First thing I will do is do my drape. Go around the table, drape it over. Then I will my supplies. That goes out. I'll set this at the end of the table. Then I will take my solution and I would open it up. I would reach around the table with the label facing in my palm. I'll reach around the table, pour my solution in. Discarded it. Then I will change the patient's dressing. I will perform hand hygiene, put gloves on. Lower the side rail and raise the bed up. Then I will assess the dressing. I will untape the dressing. I will do it away from the patient so I can assess the dressing. I will check it for coca. I will then discard into the biohazard bag. I will check the gauze for coca away from the patient, discard. Check gauze for coca away from the patient, discard. Then I will remove gloves, put them into a trash can, and perform hand hygiene. Put on new gloves. When I put my new gloves on, I will inspect the incision for Rita. I will palpate for any pain or tenderness. Then I will discard these gloves, perform hand hygiene, and now I will put on my sterile gloves. I'll make sure not to touch my sterile field. Okay, after this, I will make sure to keep my hands up so they stay sterile. I will then I will have my bad hand and my good hand. I will take a gauze, dip it in solution, or I'll go around, dip it in solution, drop it in my bad hand. I will clean the incision, discard, new gauze, solution, bad hand, clean one side of the incision, new gauze, dip it, go around, bad hand, clean the other side, and then I will discard that. Then I will take a gauze, I will take a gauze and drop it in my bad hand, and then I will pat the incision first, discard. I will take a gauze, drop it in bad hand, pat one side, discard, gauze, bad hand, pat, discard. Then I will ball this fist up and I will cover I'll take a gauze, cover the incision up, take a more gauze, cover the incision. Then I will take my ABD pad, cover it up. Then I will discard gloves, discard. I will then put on new gloves. I'll perform hand hygiene, then put new gloves on. I will take my tape. I will tape up the bandage. Okay, after that, I will cover the patient up. First, I must get my pen and I would put my initials and the date that the dressing was changed. Then I would cover the patient up. I would raise the side rail, lower the bed, and elevate the patient's head to a comfortable position. Okay. Then I would dispose of my sterile field. I would wrap it up, throw it away in a trash container. And then I would tie my biohazard sack up, throw it away in a biohazard bin. I would then dispose of my gloves, perform hand hygiene, position call bell and within patient's reach, and document.